on my morning scroll, I came across this psychiatrist who was essentially bashing this psych nurse practitioner for using or deciding not to use lithium or prescribing lithium to people with bipolar disorder. You look at the comments below, which you probably shouldn't do, but it's just kind of human nature these days. And it's just this like bandwagon of MDs that are just like bashing mid-level providers. My question is like, who hurt you? Who hurt you? Like, no, like I love doctors. My sister is a doctor. Shout out to you, Sherry, and my brother-in-law. I have friends who are doctors, amazing, amazing individuals. But was med school that bad? Residency that bad to the degree where you feel like you need to basically do the same or inflict the same type of psychological harm or, criticize your own peers or your own colleagues? Because word on the street is some of y'all don't even really like each other. Like as a bedside nurse, I find myself between the communication between an attending physician and a consulting physician. Very rarely would I see them actually talking to each other. It was always the nurse in between. Now some MDs want to come on the internet and just bash and act as if that they're not immune to mistakes or knowledge deficits. I've caught several errors by MDs. I've most recently, as a nurse practitioner, I've had to send a patient back to the hospital because they were not properly assessed. I mean, this patient was literally on the verge for biliary obstruction, and she was discharged initially by an MD. It happens. Mistakes happens. I mean, patients may not want to hear it, but it is a game of trial and error. And of course, the more experience you have, the less those errors will happen. Could our programs use more regulation? Absolutely, 100%. I'm not a big fan of online NP programs or online PA programs, if that's even a thing. But that doesn't mean that all of us are not trained properly. Like this psychiatrist who decided to put out this video, I don't know, maybe he just hasn't had an experience of practicing alongside a good nurse practitioner, because there are some fabulous PAs, fabulous nurse practitioners that are very well versed, know what the heck they're doing. Yeah, it's just sad the type of generation that we're living in where some folks feel the need to like bash a whole profession, At the end of the day, the patient is the evaluator of your treatment plan. If this provider or a psych MP says they don't want to use lithium, maybe she just had bad experiences with it. I mean, that's how he wants to practice. Me, I don't like to prescribe opioids for more than a week. Anything outside of that is going to get referred to pain management. And I work at a rural clinic. I really try not to refer because there's already limited resources in my area. Anyway, I could go on and on and on about this topic, but yeah, I just felt the need to kind of get it out there. But thank you for watching The Wholesome NP, where we discuss things related to nursing, nutrition, and integrative health. If you like this type of content, please don't hesitate to follow me on most social media apps.